And now to what scientists are calling a game changer in the fight against sexually transmitted infections, that is STIs, among women. Researchers at the Kenya Medical Research Institute, KEMRI, undertook a study to establish the efficiency of a drug that will help reduce STIs among women. According to KEMRI's senior scientist, Professor Elizabeth Bukusi, the drug, a widely used antibiotic, has proven to be effective among men and transgender women, and that this is the first time that it is being tried on women. Doxycycline Post Exposure Prophylaxis, also referred to as doxy-PEP, works like a morning-after pill for STIs. Professor Bukusi says that the study focuses on women who are already receiving HIV Pre-Exposure Prophylaxis, which reduces their chances of getting HIV but leaves them vulnerable to contracting STIs. Safin Acheng Oma reports.
Kenya's goal of combating the spread of HIV and AIDS through the administration of HIV Pre-Exposure Prophylaxis among vulnerable populations is now under threat, considering the surge in sexually transmitted infections being reported among those already taking the HIV prevention drug. According to Professor Elizabeth Bukusi, a senior clinical research scientist from the Kenya Medical Institute, the rates of STI infection among women on HIV PrEP drug remains high, with the burden of infection concentrated on the youth aged between 16 to 24.
We are talking about young people aged between 16 and 24, particularly young women. I worry less about the men because they tend to get symptoms, and they will often seek. If someone has discomfort, they're going to seek medication, they're going to seek treatment. The problem is young women don't get symptoms, and therefore they don't seek medication because they don't know.
But now, there is a promising way to prevent the spread of STIs. Professor Bukusi is part of a team of researchers from KEMRI who, in collaboration with the University of Washington and Hennepin Healthcare Research Institute, undertook a study of the effectiveness of Doxycycline Post Exposure Prophylaxis in preventing sexually transmitted infections among cisgender women, which simply means women who are assigned the female gender at birth and still identifies and live as women. Doxycycline Post-Exposure Prophylaxis, also referred to as DPEP or doxy-PEP, is an antibiotic which essentially works like a morning-after pill for STIs, said to be effective if taken within the first 72 hours after having unprotected sex. So far, it is only recommended for gay men and transgender women. According to Professor Elizabeth Bukusi, the drug has proven to be highly effective, and that this is the first time it is being tried on cisgender women.
Among men who have sex with men, similar studies have been done because they also have very high rates of sexually transmitted infection. Doxy has been proved to be very effective. It actually works.
A study that was published earlier this year in the New England Journal of Medicine found a 65% overall reduction in the new STIs among those who took doxycycline within 24 to 72 hours after having unprotected sex. DPEP cut new cases of chlamydia by about 80% and gonorrhea by more than 50%. It also reduced cases of syphilis. The study in Kenya was done in Kisumu County and targeted 449 cisgender women who partake the daily oral HIV PrEP. The women were divided into two groups. One group took the doxy every time they had unprotected sex, and another were put under standard of care, meaning they were treated for STIs only after symptoms showed. While the initial stages of the study indicated that the incidence of STIs was not significantly lower with doxycycline PEP than with standard care, the researchers also established that the use of doxycycline PEP among those assigned to receive it was extremely low, hence compromising the expected results.
We also tested hair samples, and the hair samples were to see, did they actually take the medication? Was their medicine, the doxy, in their hair? Because we can test it in the hair to show that they'd actually taken. Unfortunately, only a third of the population were actually taking. The reality is if you don't take it, it cannot work.
But the top-line results are not necessarily the final word. Professor Bukusi emphasizes the need for more effort to help these women to protect themselves from sexually transmitted infections, which remains a major cause of reproductive health complications like infertility, preterm birth, and congenital infections.
We need to do more in finding ways of reducing sexually transmitted infection. We are doing a relatively good job with HIV. We still are not doing well in terms of the other sexually transmitted that also take a toll on people's health.
In the meantime, they are working to find ways to support adherence by the targeted women following multiple studies that have shown high levels of protection of other STIs. Due to the promising results, federal guidelines are now being finalized in other parts of the world so that more doctors and public health departments can offer it to those who are at high risk of STIs. Safin Acheng Oma, Citizen,